Hello, my name is Dr. Christopher Austin, and I'm the Chief Medical Officer of Chiron Medical. Thank you for your interest in our latest solution, MIA IQ. I'm really excited to walk you through some interesting demonstration cases that really highlight the powerful performance of this solution. MIA, which stands for Mammography Intelligent Assessment, is our suite of AI solutions for breast cancer screening. MIA is designed to empower radiologists and screening services to deliver confident, accurate, and timely results to any woman anywhere. In this presentation, we will be focusing on the latest solution in the MIA family, MIA IQ, our AI-enabled solution for breast positioning and image quality assurance. With the input of the LRCB, the Dutch Expert Center for Screening, who oversee one of the most respected screening programs in the world, we developed MIA IQ. This FDA-registered device retrospectively reads digital mammograms and provides a detailed technical assessment of breast positioning and image quality. These automated outputs standardize the assessment of mammograms from an individual imaging center or across multiple facilities. This enables screening programs to identify image quality issues, allowing them to take proactive corrective action, develop relevant training for their center, and drive continuous performance improvements for mammography technologists. MIA IQ also helps to ease the administrative burden of preparing for external audits, such as MQSA Equip. The automated analysis of image quality criteria reduces subjectivity. On your screens, you can see an example of the MIA IQ evaluation criteria. This can be tailored to your institution and clinical needs. I will now show you some real-world examples of how MIA IQ analyzes some of these selected criteria. The pectoral muscle is an important structure signaling whether the breast is appropriately included in the image. The appearance of this muscle on the MLO view includes a couple of elements. First of all, it has to be wide enough. This is measured with the angle between the pectoral muscle and the medial margin of the image. As a threshold, it is meant to be 20 degrees as minimum, with the angle of distal point at or beneath the pectoral nipple line, or P&L line. This is a line drawn perpendicular from the lateral margin of the pectoral muscle to the tip of the nipple. If the angle reaches this threshold, the criteria is adequately fulfilled. As you can see, in case 1, the width does not reach the 20-degree minimum. Also, the pectoral muscle ends far above the P&L. This positioning raises the concern that the axillary part of the breast, where 40% of cancers occur, has not been adequately imaged. Case 2, however, does satisfy both of the criteria, and so it was considered to be adequate by MIA IQ. Another criteria related to the pectoral muscle states that the anterior margin must be convex or straight. In this case, MIA IQ considered the criteria to not be met as the pectoral muscles are insufficiently relaxed on either side, with a concave, not convex or straight appearance. Positioning the breast so that the nipple is pointing forward and is within a threshold angle from the most prominent point of the breast ensures that both the medial and lateral parts of the breast are visualized on the image. In this case, MIA IQ identified that the nipple is not pointing forward, especially on the right side, and so the criteria was not met. The next example focuses on the sufficient spread of breast tissue. If the skin is folded, it is a signal that the breast tissue has not been spread well enough onto the detector. Even thin folds can cause problems for less experienced readers as they may mimic architectural distortion. In this case, MIA IQ suggests that the criteria was not met. On the right, the inframammary angle is missing, and on the left, the inframammary skin fold is not sufficiently demonstrated. Skin folds can also cause significant problems as they can obscure relevant areas such as the axillary region and can impede the radiologist from picking up signs of an early cancer. In this case, thick skin folds in the axillary region bilaterally, as shown by the red arrows, provide insufficient visualization of lymph nodes. This case was considered to be inadequate by MIA IQ. Another critical indication of full inclusion of the breast parenchyma on MLO views is how the inframammary area is visualized. The skin should run smoothly from the breast onto the abdomen, formulating an open curve beneath the breast. If this open curve is not demonstrated, the entire breast may not be well visualized, creating the chance to miss a possible cancer. In this case, a significant amount of breast parenchyma is missing from the image in the lower aspect due to malpositioning. MIA IQ considers this image to not adequately meet the criteria. And finally, one of the most frequently overlooked criteria is that the breast is not positioned in the middle of the detector table. It can be measured by assessing whether the middle of the breast, midpoint of the PND, is located around the midline of the detector table. The reasoning behind this criteria is not only that this is the only way the axilla can be included, but also that it is the only position in which the compression can be optimized. In order for the dose automation cell to ensure the appropriate dosage has been given by the X-ray tube, the thickest part of the breast needs to be located on the midline. In this case, the center of the breast is out of the midline range of the bucky, and so MIA IQ considers it to be inadequate. I've come to the end of the demo, but hope these cases have illustrated how MIA IQ uses the power of AI to improve breast positioning and image quality, ultimately laying the foundation for your screening service. I'd welcome the opportunity to meet with you and talk more about your breast screening service and MIA IQ's capabilities. Please do feel free to get in touch via the email address on your screen, and thanks so much for your time and your interest in MIA IQ.